Okay, I'm going to do this without slides. I always bring it back. Okay, thank you very much. So I'm Lindsay. I'm a nurse by training. I've been working in heart and stroke and other healthcare facilities for over 40 years. And I've been part of a big group that's been championing women's heart and brain health. How many of you know somebody who's had a heart or brain condition? A woman. How many of you know a mother, sister, aunt, friend? Okay, everybody. Do you know that, so, okay, let me ask you this. What do you think is more a risk factor for women? Breast cancer or heart disease?
Heart disease.
Okay, more women die, 5 times more women die of heart disease or stroke than breast cancer. Do we know this? Have you heard this? No, it's because breast cancer have better marketing department. Right? And because we always think of the Hollywood heart attack, the older man who has the big head crushing chest, right? So, if in 10 minutes, I'm hoping to at least raise your awareness. I'm not going to go into the science of heart attack today. This is about risk factors. This is about increasing your awareness of the risks for women and also asking you to step up. Talk to your girlfriends about it after this. And when you go to the doctor, because you know your body's better than anyone else, and you're having weird symptoms and you tell them and they say, oh, it's menopause, it's anxiety, it's stress. Say, no, actually, I want you to check us out. Because more women than men are sent home from the emergency department with their symptoms being blown off because they aren't being recognized because they're not exactly the same, and then they end up dying. So today I just want you to be aware of some of the risk factors that are specific to women and things that you may not know about, things that you might. So first of all, the important things are, it's not just a disease of the elderly. Okay? Oh, I actually get slides. Do you have a clicker? Yeah. Yeah. So the disclaimer is that I am not a medical doctor. If you put up your hand and ask questions that are very personal, please don't. I'm happy to talk to you afterwards and give you advice on where to get answers, but I will not provide personal medical advice to each of you because I can't do that. It's not within the nursing scope and not appropriate to this talk. So, as I've already said, that heart disease and stroke are the #1 cause of premature death of women in Canada and around the world. All the pictures you see are women that I know, that I've personally worked with, who have either gotten heart disease, stroke, and Lou just passed away this past December. I've known her for 30 years and she's been very important to me. So every 16 minutes, so in the course of the hour that we're here together, we've lost 4 Canadian women to these diseases. Canada, you don't stay with it.
Yeah.
Okay.
You just do that.
Go to the next one. Keep going. So the other things to know is that it is a disease of older women, but it's a disease of younger women too. There is no age limit to when somebody can have heart disease and stroke. So don't wait till after menopause to start thinking about it. Don't wait to tell your children, your daughters, your cousins, your aunts, your nieces. This is something that we need to think about much earlier. What we know is that of all the people in this room, just looking around, 90% of you have at least one risk factor. How many of you know about a risk factor? You don't have to put up your hand. Just think, do you know that you have a risk factor? Do you know what it is? So next. What I want you to do, and what we're going to do in the next few minutes, is think about, what I want you to do is just be aware. So hearing me talk today, be a little bit more aware and thinking about women in these conditions, because they're not a man's condition. I want you to take a minute to assess your own risks. Think about it for a minute. Just think about yourself, which is something women do really badly, right? Somebody said today they ran up to Bolton to help their son because he called. You know, you're taking out the garbage, which is what I was doing before I left because it's garbage day. You're doing all these things for everyone else. Women are the worst at taking 5 minutes for themselves. And you need to do that because if you don't, you won't be here for anybody else later to help them. So I want you to be aware. I want you to assess yourself and then think about taking action. There's 3 highest risk times, but these are not the only times. Pregnancy, menopause, and as you get older. Next. Okay, so if we take a moment and think about our risk and do something about it, we can postpone heart disease and stroke or death by 33%. It doesn't take much to shift those odds in your favor. And if you manage them after you've had an event, you can actually reduce the risk of death or another event by as much as 25% or more. So every little bit counts. You know, we hear that with all the charities that have been here and talking to us, that every bit counts for them. Every bit of action you take for yourself counts. It all adds up. So let's talk about some of the risk factors we can't change. You cannot change your age. Boy, I wish I could. I'm 62. You can't change your sex. You can't change your ethnicity. And you can't change your family history. But if you know those things and what the risk brings, you can change other things to counteract the fact that there's some things we're stuck with. Okay? And I come from a family of heart disease as well. And one thing I'll reveal is at the age of 38, I had a stroke. No risk factors personally, no sign of it. Had a stroke with a 2 to 5 year old. So I'm speaking from personal experience, and that's why I'm passionate. Here are the things we can change, and these are the ones you've probably heard about, and you think they're all man's business. High blood pressure. Okay? It's starting to happen more in your 30s instead of your 50s and 60s. It's happening way before menopause instead of way after. High cholesterol. It is a condition for a lot of people, and if you have a family history, your risk is much, much higher. Diabetes. Smoking. Now, if you're a woman who smokes, are on the birth control pill, and have a history of migraine, your risk more than quadruples. So think about that. Psychosocial factors. There's all kinds of new information coming out about isolation, social isolation, loneliness, senior women, right? Because the guys die really early. So we're left living a lot longer. Social isolation is becoming one of the biggest risk factors for women's heart and brain conditions. Who knew? So if you know a woman who's lonely, who's living alone, reach out to them, give them something to engage in. It'll reduce their risk. And then overweight and obesity, big problem. You know, there's new drugs now that everyone's climbing to, but it still puts you at risk. Thanks. Here's things that you might not know about. Okay, without putting up hands, how many of you had diabetes or high blood pressure in pregnancy? Don't tell me, but just think about it. If you did anybody at that time tell you that your risk of heart disease and stroke within 5 years of that pregnancy goes up? Most women I talk to, and I recently did an audience of 400 women, and when I said that, you can just see who wasn't told, because you can just see their faces in the audience. Having complications in pregnancy puts you at risk within 5 years. Having multiple miscarriages puts you at higher risk. Going through infertility treatments, nobody talks to you about IVF and what that might do to your heart 5 years down the road, puts you at increased risk. Early menopause, and even early and late menopause puts you at increased risk. Polycystic ovary disease, no one talks about that or knows what that is, or the fact that having that will lead to increased heart disease and stroke. Inflammatory disorder, rheumatoid arthritis, lupus, some of these other Marfan syndrome, some of these other conditions that are affect more women than men. You rarely see them in men. They put you at increased risk. I talked about smoking and then diabetes. And there's other things like normal things like irregular heart rates, afibrillation. More women have worse heart disease if they've had it because of AFib, and more women will die, and more women are undertreated because everyone's afraid to give them full dose drugs, so they undertreat them with these conditions, and then they run into bigger trouble. So not all doom and gloom. We'll get to the good parts in a minute. So one thing to say is some of these risk factors appear at different stages. So as you go through your whole lifespan, some things like obviously pregnancies in your 20s and 30s, menopause in your 40s and 50s, polycystic ovary can be any time. We also know that babies born with weird hearts are at much increased risk of stroke, 10 times increased risk of stroke for their lifetime. So think about those little babes that we have. So over the lifespan, different conditions appear and put you at different risk. Thank you. Okay, pop quiz on it. You won't be able to see this very well. Here's a list of all the things I've talked about. Take 2 seconds to go down that list and count how many risk factors you might have. Don't tell me, keep it to yourself, but I'd have to chat with you after. It's just to kind of get you thinking, right? And I'll give you websites where you can go and actually see this and get access to it. Okay? There are pamphlets by Heart and Stroke, which I helped create. I've got some other pamphlets here from the Canadian Women's Heart Health Alliance, which I'm a committee member of, where our whole job is to go out and promote women's heart and brain health. So there is good news. You can actually do things about it. It may not totally take away your risk, but it can certainly reduce it. And reduce it a lot, as I said earlier. Okay? Be active. And this doesn't mean going to the expensive gym and doing all this fancy exercise where you have to buy whole new outfits and everything. I don't do any of that. I'm not a gym person. Okay? It's getting outside. It's gardening season. I couldn't wait to get the snow gone and we finally have our landscaping. Get out there and garden. Take the lawnmower away from your husband. My husband and I actually fight about it because to cut the lawn in a good way. Because just pushing the lawnmower is great exercise. Right? Go for a walk. Minimum of 10 minutes at a time and not a slow saunter. Get your heart rate up. Moderate to extreme, like go fast. You should be aiming for under a 12-minute climb. That really gets your heart rate up. So go for a walk around a few blocks. Every few days, go 1 block further and 1 block further until you're going at least 3 or 4K at a time. It won't take you about half an hour. You can do 3K in half an hour. So work up to it. Food. Food's a real challenge because as we've heard from these wonderful women who presented today, it's great to say eat fresh fruits and veggies. People can't afford fresh fruits and veggies. So we have to be creative in our advice about what you eat. I've traveled many communities in Canada and I visited 8 different First Nation communities. And our advice to them wasn't stop eating whale and caribou. But when you're cooking your greens, don't use a 4-inch cube of bear fat to cook your greens in. Maybe use water or broth. So simple little changes, but you have to meet people where they are. We can't tell them to eat fresh fruits and vegetables if they can't afford it, right? It's such a big issue. But think about eating healthier, carrots and celery instead of chips. But the other philosophy is you don't have to drop everything. Everything in moderation. It's not these great big changes because those don't survive. You cannot survive. A lot of people, when you do these big magnanimous New Year's changes, mid-January they're gone. Little things. Go 1 block more every few days. Eat one last thing, eat half your slice of pie instead of the whole slice. Half a cookie instead of 1 cookie. So it's not cutting it all out because that's so hard. Moderation. Okay? So tobacco and vaping. All of those everyone who tells you vaping is good for you because it helps you stop smoking. Our young women, our high school girls, they're the biggest group of people starting to smoke, and it's because vaping has been a big way. Because it's bubblegum flavored and it's sexy, and you get these pretty pink and orange and multicolored holders for your vape. 1 package of vape has more nicotine than a pack of cigarettes sometimes. So really don't think about vaping as a solution. For some people, there is a role for it under a very careful circumstance, but not for everyone. Alcohol. Okay, looking around the room, I already had my glass of wine. I did 6 instead of 9 just so I didn't feel guilty giving this talk. Moderation, again. Not having 3 drinks a day, but have, moderate how much you drink. Because the more you drink, the higher the risk. And regular checkups. How many of you know your blood pressure numbers? Do you know your cholesterol numbers? Do you know if they're good or bad? Just because you know the number, do you know if it's a good number or a bad number? And is it the right number for you? So know these things. So one of the things I have to tell women, and I hate having to tell women, you have to be the squeaky wheel. More times than not, you'll not get taken seriously. Be prepared for that, but be prepared to talk back. Doctors are not gods, whether they're female or male, and sometimes the female doctors are worse. You know yourself, you know your body, you know it's different. You know when it's not normal, and it's okay to question and to push back. I've had so many women tell me they walked out even though they knew they weren't getting the right advice, and then they end up in hospital. I've had women tell me that when they went to the doctor alone and told them their symptoms, they got ignored. When their husband or son came with them and said, oh yeah, my wife has been experiencing this, oh okay, let's look into it. You shouldn't have to have a man in your family, in your life, speak up for you to push your heart, to get your health checked. And it's okay to be the squeaky wheel, and it's okay to push back, because most people feel they need permission. I'm giving you permission. I'm begging you to do that for your own sake. Okay? Keep track of your questions before you go to see a healthcare provider. Write your questions down. When you're there, make sure they check your blood pressure. Say, oh, I want to check, I need to know what it is. You know, I'm feeling off, want to know. Make sure you know your numbers, write them down, keep them with you, and get them checked regularly. I'm not saying go out and buy a blood pressure machine, they're expensive. There are good ones, I'll show you where to get them if you want. When you're at the grocery store, stick your arm in the machine, or in the drugstore, they're available. Know your numbers. Know what your numbers should be. Okay? When you go to a doctor or talk to healthcare, take notes, write things down. It's okay to do that. Okay? So that you remember and you can go back to it afterwards. Okay? Next. You know, you might need to take someone with you. If they use a bunch of jargon, stop them. I used to run a medical conference with people with lived experience, and I gave them all those squeezy brains, you know, little stress balls. And I said, every time one of us uses, you know, complicated language you don't understand, throw the ball at us. We had a lot of balls thrown at us. They didn't hurt. But it raises awareness for healthcare professionals that they need to speak a different language in order for people to understand and be able to act on their advice. Ask for repeat, like, you know, can you go through that again? Let me just check to see I got it right. Make sure when you leave, you have a way to follow up if you need to, because most doctors' offices these days are impossible. Now, in fairness to physicians, 1 in 6 healthcare Canadians don't have a family physician because they're so overloaded and there's so few of them right now. They're doing the best they can. People in healthcare really honestly want to do a good job and care for you. They're just under such huge stress right now. The system is stressed, and so we have to make a little more noise to be heard sometimes. If you look on this slide, these are all some of the women you've seen. When I said to them, what would you tell women if you were talking to them right now? And this is kind of some of the feedback they gave me. So all the women you've seen in my photos, they're all real women that I've worked with, and this is some of their advice. You know, hold on to your family and your best friends, keep them close. You know, you will need them, and it is okay to ask them for help. It is okay to say, you know what, I'm not having a great day. I can't go pick up my son or run around getting, you know, whatever they need, because I need some time for you. It is okay to take that 5 minutes or that day for you so that you're here tomorrow to help the others, okay? Really important. So I've got some pamphlets right there in that on that table, which we can maybe put over here. Pick up. So the Canadian Women's Heart Health Alliance, which runs out of Ottawa Heart, we're an alliance from across the country. We had a Women's Heart and Brain Summit at the end of April, where there was like 500 people talking about this, including many women with lived experience. You can get the website there. They have great resources. You can also go to heartandstroke.ca/women to get resources. There's a risk assessment tool that I helped create that's just been launched up there, or is being launched. You can check out your own risk, and there's a whole education program that goes with that, so I encourage you. Please look after yourself so you can look after others, because that's our jobs. Whether we want to or not, that's our jobs. It's a very sex and gender thing. But don't take your heart and brain health lightly. They are the #1 killers of women around the world, including in Canada. And I'm happy to take some questions. Thank you.